Health Department issued new guidance on the outbreak today. They're now advising that any public gatherings of 50 or more people be modified, postponed, or canceled altogether. And the so-called worried well are reportedly crowding at emergency rooms in Lafayette. Jeff has Tippecanoe County Public Health Officer Jeremy Adler in studio for more.
All right, thanks, Meredith. Dr. Adler, thanks. Good to see you. Second time in about 3 or 4 days, less than a week. Let's start with the emergency rooms. Are local ERs being inundated with people who really shouldn't be there?
Yes, what we're hearing is that the emergency departments are being literally overrun by people who just don't need to be at the emergency departments right now. Our ERs are for the, people who are very ill, not for people with mild symptoms or no symptoms. So it's very important that people who just have mild cold or flu symptoms should not go to the ER. They should call their healthcare provider. Their healthcare provider might advise them to stay at home until they're better. They might advise them to come to the office to be seen, but they should not go to the emergency department.
Okay, and I've been told sort of anecdotally that people are showing up at ERs asking to be tested for coronavirus.
That's correct, and that's a big problem. One of the big issues facing us right now with coronavirus is that there just aren't enough tests here in Indiana and across the country.
Do we have tests here? If somebody really needed to be tested here, would that person get a test here?
Yes, there are tests available. However, tests are only being done in the ERs on critically ill patients, okay? So if you're not critically ill, you should not expect to be tested for coronavirus in the ERs. Another important thing is that employers and other community organizations should not be sending individuals to the ER to be tested for coronavirus. The ER, again, is for our very sick people who really need that emergency level care.
Now, why the guidance today on mass gatherings of 50 people or more?
Sure. You know, while we still have no confirmed cases of coronavirus in Tippecanoe County, what we are observing is increased coronavirus activity throughout the state of Indiana and across the U.S. And because of this, it is very likely that we can expect to have some confirmed coronavirus cases in Tippecanoe County soon. Now, exactly when that is and to what extent, we don't know. But because of that, we all need to be prepared. And part of our preparation at the health department is ramping up preventive measures such as the one that we released today, which is advice and recommendations about modifying or canceling public gatherings of 50 or more people. This recommendation comes in addition to the recommendation we made yesterday that nursing homes begin visitor restrictions, and that's in addition also to the recommendation we made last week that elderly people and people with weakened immune systems need to avoid public gatherings altogether. Best for those folks to stay at home as much as possible.
Okay, Dr. Jeremy Adler, something tells me that this won't be the last time that we have you in the studio to talk about this particular topic. And I do want to note that Dr. Adler actually shook my hand when he was here on Friday. Today we're not doing that, so we're changing some personal habits.
That's correct. It's been a hard habit to break, but it's an important one at this time to avoid handshaking.
Okay, very good. Thank you so much, Doctor.
Thank you.
Well, 2 men are facing